Hi, my name is Deb, and thank you for the opportunity for asking me to relate my journey with all of you about ototoxicity and my experience having ovarian cancer. I didn't feel as though I was prepared for the aftermath and recovery experience from this major surgery. The healing process was very uncomfortable and took about 2 months. At the post-op appointment with my oncology gynecologist, I was told she removed all the cancer and I had an 80% chance of full recovery with chemo, and that I would have an aggressive chemotherapy treatment. She felt that I would tolerate this because I was in excellent health with no comorbid medical conditions. So, how did I feel? Well, I was definitely scared. I was overwhelmed. I was stressed. I was sad, but I was very hopeful. One of the questions I had for myself was, how was I going to make it through this grueling treatment? Well, the preparation for chemo was a 2-step process, and it began a month post-surgery. First, I had chemo counseling with a nurse practitioner, and then I had surgery to place 2 Metaports in my body. During the chemo counseling with the nurse practitioner, we talked about the drugs that I would be taking, the chemo drugs, as well as other medications they would give me to stave off some of the side effects from the chemo drugs. And we talked about possible side effects that I may have. There were many. And the theme of the counseling was side effects differ among patients. Every patient has their own journey. We have to see what happens. So I was told I was going to get 2 types of chemo, one being Taxol and the other cisplatin. Now, cisplatin's ototoxic, and I wasn't counseled about the ototoxicity of cisplatin. However, I knew about this because I'm an audiologist. So I questioned the nurse practitioner about the potential of ototoxicity and the protocol they had to monitor ototoxicity. She minimized the possibility of the ototoxic side effects. And I was told that there was no protocol in place and that most women don't end up having hearing loss or tinnitus from the dosage of cisplatin administered. Some patients may experience tinnitus, but definitely not hearing loss. So I related my concern about the possibility of ototoxic side effects, and I told her that I have a hearing loss and I wear hearing aids. So the side effects that I experienced included imbalance, cognitive issues, including short-term memory deficit and deficits in oral communication skills, many digestive tract issues, malaise, bone pain, and sleep disturbances. I suggested it would be best practice to monitor and document these side effects. I felt fortunate because I did not experience increased tinnitus or hearing loss with this chemo regimen. And I will say I realized too that this woman, my gynecology oncologist, saved my life. So I was in a bit of a compromising position, but I felt good about self-advocating, which I did. We talked about potential side effects with the medications. Similar information was shared with me as in 2018. A protocol to monitor ototoxicity was still not in place. However, one change occurred. At the start of each treatment appointment, the nurse administering the treatment asked me some questions about ototoxicity. I was pleasantly surprised. Do you have ringing in your ears? Do you feel like you have a hearing loss? How's your balance? Well, I didn't experience ototoxicity side effects with the carboplatin. The volume of my tinnitus did increase as I took the cisplatin. The second dose, the second round, resulted in me feeling that the volume of the tinnitus increased. And then the cisplatin doses were cut per protocol allowance. And so the volume of the tinnitus subsided. That was a relief to me. It was recommended that I have my hearing tested by an audiologist. Was this change due to my self-advocacy and discussion about ototoxicity? I don't know. I didn't have the testing done because this was occurring during the time that the COVID pandemic had already hit. So there was no audiology practice or audiologist in the cancer center, and most local audiology practices were closed. I struggle with the fact that hearing seems to be something secondary to most physicians. I understand it's not a life or death type situation in terms of whether you have normal hearing or hearing loss, but certainly there is the communication function aspect, which I haven't really touched on, and that's critical. You know, if you're not hearing well and you don't treat the hearing loss, you tend to be more isolated, and that can result in depression, and it can also enhance or escalate the cognitive issues that you may already be having chemo treatment. Life is a gift. It's important to be present and to participate and be patient. Acceptance that you have an illness, a serious illness is tough. But I know that my journey made me stronger.